I think fundamentally it's designed by clinicians for clinicians, and that's what they like.
The areas that I think are particularly important are setting a standard for clinical quality that the whole NHS can sign up to. As a PCT person, I'm particularly interested in its use for commissioning, and in our local situation where we have a number of providers of services, it gives an opportunity for setting a standard shared by all our providers rather than dividing ourselves into different health communities.
I'm Medical Director of a trust, a DGH, and I think in terms of encouraging uniformity of care, that's where it'll have its greatest use for me, because I'm very interested in the quality and safety agenda, and we've been looking at toolkits from the Institute of Healthcare Improvement in the States and so on. And this just all fits in with that beautifully.
So I think the main benefits are actually using evidence-based medicine in practice. I'm a physician by training, and I'm using it, and some of my colleagues are already using it, but it has to be a translation to Swedish or Norwegian or Danish, of course. But some physicians are speaking English quite fluently, so that's very interesting that we can use it in this form. So in a couple of years, we hope that we will have a Norwegian map of medicine. I
am enthused about it, and I can see uses for it clinically. I'd like to see it wider, and it was my question, about purely podiatry or physio or OT pathways. Considering the way that healthcare is going, with AHPs and nurses leading it, I think it has the flexibility and the will that it could go that way.
Well, I think it's a massive step forward, really. I've been working in evidence-based medicine and quality improvement for about 10 years, and we've struggled with this sort of thing. So having it easily accessible and reliable is a great step forward.
We're taking the map into New Zealand, so we're looking at taking this. So when they reference Commonwealth countries, we were looking at taking this into New Zealand. And that conversation is currently underway, so it's quite interesting from our point of view. I'm here with a colleague of mine, Richard, and we're looking at the experiences in the UK, how it's being adopted, what the key issues are, and so the whole day was fantastic from our point of view, absolutely tremendous.
Our pathway is quite multidisciplinary, so it not only covers, the doctor's care of the patient, but also, the role of the breast care specialist nurse and palliative care team and so on, which is all very important. And I actually think the map's a really useful tool not only for the clinicians but for the patients, and I'd love to see them accessing it too.